Hello, my name is Brittany Hager, and I will be telling you what tobacco is, a few facts about tobacco, some ingredients that are found in tobacco and cigarette products, and also dangerous everyday products in which the same ingredients that are found in tobacco, they're found in these products. So let me get started. What is tobacco? Tobacco is a plant that is indigenous to America, meaning that that plant was once only grown here, but now it is grown all across the world. The leaves of this plant contain a high level of the addictive ingredient called nicotine. Nicotine is the ingredient that people become addicted to once they start smoking. And it also contains other cancer-causing agents, especially polyaromatic hydrocarbons. The leaves of tobacco plants can be smoked in cigarettes, cigars, and pipes, applied to the gums as dipped in chewing tobacco, or inhaled as snuff. Nicotine is now being extracted from leaves and used in e-cigarettes. E-cigarettes are those fancy little pen-like things that people refer to as vaping. It is thought that these things are safer. It's like a safer alternative to smoking, which is kind of true, but kind of not. There's like no scientific evidence that really backs this claim up, so people are kind of risking their lives smoking e-cigarettes as well, so don't think that that's safer. Facts. Smoking is the leading cause of preventable deaths worldwide, meaning that if people would just quit smoking or try to avoid it at all costs, stay around people from smoking, they can live longer. It increases your chances of living. Okay, more than 16 million Americans are living with diseases caused by smoking. These diseases can include, but are not limited to, lung cancer. It increases your chances of liver cancer, stroke, diabetes, and specifically type 2 diabetes. Vision loss, it increases your chance of developing cataracts. Erectile dysfunction. The smoking builds plaque inside of your arteries that can block blood flow down to the male sexual part. Ectopic pregnancy and tuberculosis. Like if you've had tuberculosis, smoking increases your chances of getting tuberculosis again. Smoking costs the United States billions of dollars each year. Each day, about 2,000 young people under the age of 18 smoke their first cigarette, and this is what can lead to years and years of addiction. And over a period of time, they start building up a tolerance and they start smoking more packs of cigarettes per day, which really increases their chances of these diseases that I just mentioned. Smoking harms nearly every organ in the body. Okay, ingredients. Ingredients include nicotine, which is the addictive ingredient that produces the effect that people are looking for, hydrogen cyanide, formaldehyde, lead, arsenic, ammonia, benzene, carbon monoxide, nitrosamines, polycyclic aromatic hydrocarbons. I'm not sure if that's how you pronounce that. I think it's like polycyclic. Other places tobacco ingredients are found. These are like the everyday products that people use. Okay, carbon monoxide is found in car exhaust fumes. So when you go crank your car up and it's really cold outside, that little puff of smoke that's coming out the back of your car, that contains carbon monoxide. People can also die from carbon monoxide poisoning. Arsenic is used in rat poison. Benzene is found in rubber, cement, and gasoline. Formaldehyde is found in embalming fluid, which is what is placed in people who have died. It like cleans out their system, all the waste and the blood. Yeah. Lead is used in batteries. Nicotine is used in insecticides. So, insecticides are sprayed on like plants to keep bugs away. Basically, kills them, keeps them away. And most people like plants. I mean, most people don't like plants that have insecticides on them. That's why most people get organic stuff, so they know there's no insecticides. Yeah. So why do people smoke? People smoke for many reasons. Most people start smoking in their teen years. Nicotine is the main culprit behind a person's addiction to tobacco products, which is what I mentioned earlier. Nicotine affects a smoker's behavior, mood, and emotions. If a smoker uses tobacco to help manage unpleasant feelings and emotions, it can become a problem for some when they try to quit. Like in other words, they use smoking as like their coping method. They use it to take their mind off of things to relieve stress, or it's just something they like to do. The smoker may link smoking with social activities and other activities too, meaning that they might smoke at parties when they see other people doing it, or one of their friends might be smoking and they think that they should join in just to be cool. With the U.S. paying billions of dollars each year to fund tobacco advertisements, these products are able to appeal to large audiences, especially gullible teens and young adults who are looking to fit in. And also a little fun fact, my aunt was recently diagnosed with lung cancer. We're not sure what stage yet. They're doing a biopsy to find it out. But the doctor did tell her that it was curable, so I guess it's not that bad, but they told her to stop smoking. And keep in mind, she's been smoking for years, since before I was born. And like, honestly, she's still smoking. And so I asked her, I was like, why don't you just quit? Don't you want to live? And she was like, yeah, I want to live, but she told me that she just can't go without smoking cigarettes because it's just something that she's done for so long, and when she tries to stop, she gets like withdrawal symptoms, like she gets irritated, she doesn't feel well, she gets headaches, and she also just feels like it's a part of her that's missing. So hopefully she'll find an alternative to smoking so she can live. But yeah.
When you smoke, it affects more than just your health. I love to dance. That's something that I handed down to my family. I was pretty good at it too, before my doctor told me that secondhand smoke at work caused me to have asthma attacks, infections, and lung damage. And I never smoked. I can't work there anymore. And I can't dance much anymore either.
If you or someone you know wants free help to quit smoking, visit cdc.gov/tips.
As you can see from this video, we have an individual named Nathan who is 54 years old. He loves to dance, but due to secondhand smoking, he can no longer work, nor could he dance. And because of that, it has led to asthma attacks and lung damage. Now, if you notice at the end of the video, he said he can no longer work. I can only imagine the financial struggles his family, his wife, or mom and father are going through to help provide for his family, which will be why I'm transitioning into what is secondhand smoking. Secondhand smoking, also known as passive smoking, is the inhalation of smoke by a person other than the intended active smoker. So, for example, if you're by someone who is smoking, you will be the individual who is receiving secondhand smoke. You're taking in the chemicals that they are letting out of their body. Secondhand smoking was linked to only lung cancer for the longest, but based on the first Surgeon General report in 1964, they soon determined that there are other health problems associated with secondhand smoke. A study done in 1981 showed that non-smoking women married to husbands that smoke had a higher risk of getting lung cancer than women married to non-smoking husbands. If we look at the effect of secondhand smoking geographically, the risk of lung cancer among non-smokers is consistent. So, for example, here in the United States, if you have someone who's receiving secondhand smoke, this increases their chances of lung cancer. Now, if we were to go to Europe and someone who's receiving secondhand smoke, this still increases their chances of lung cancer. So it's consistent no matter where you are in the world. So moving on to secondhand smoking part 2. Secondhand smoking is the third leading cause of preventable deaths. It kills approximately 53,000 non-smokers each year. For every 8 people that smoke, 1 non-smoker dies with them. 30 minutes of exposure to secondhand smoke can cause heart damage, similar to those who smoke on a consistent basis. So while I was doing my research, finding this out was very shocking. The fact that you have someone here who's taking care of themselves or not putting these harmful chemicals into their body, they still have the similar chances of getting heart damage of that who smokes on a consistent basis is upsetting, which is why I believe that places free from smoking should be established. It's the only effective way to prevent health problems of those related to smokers. This is a great idea, and I noticed that it has been implemented in today's society. Just like SFA, for example, they have the the part where you can't smoke on campus or within the dorm halls, which is great. Now I will be talking about chewing tobacco. Chewing tobacco is a common type of smokeless tobacco. This product contains nicotine, which makes it addictive when you start using it, along with many more ingredients. This increases your chance of oral cancer, along with pancreas and esophagus cancer. Manufacturers love to push the idea that if you're trying to quit, you should use smokeless tobacco because it helps people quit. But this idea has not been proven by the FDA. In my opinion, I feel that manufacturers can see that people are starting to not smoke anymore, so they're trying to increase their profits by pushing the idea that if you purchase our chewing tobacco, this can help you quit. This is a great transition for you, which I don't believe is the case. Now, some warning signs for chewing tobaccos affecting your health in a negative way is if you see sores on your lips and gums, the mouth starts to bleed very easily and it doesn't necessarily heal, if you notice any lumps or thickening of the soft tissue in your mouth, or if you see any red or white patches. Another sign is that if you have difficulty in swallowing, chewing, or moving the tongue or jaw are often signs of health problems, and I believe you need to go receive some health assistance immediately from your physician or doctor, whatever you use to check on your health. After doing all of this research, it really made me ask why and what started chewing tobacco. Native people of North and South America chewed on tobacco, but in Europe, people would chew and snort. This was mainly popular over there. In the United States, chewing tobacco was associated with baseball. They did it to keep their mouth moist, and by spitting into their glove, it kind of softens the glove. It also coined the term spitball. And spitball, essentially, it helps the player throw the ball easier. In the 1950s, chewing tobacco kind of fell off, and people were no longer using it. Instead, people opt to use smoking. Smoking, like they would smoke tobacco. But by the 1970s, people were more aware of the dangers of smoking tobacco. And as a safe alternative, baseball players went back to using chewing tobacco again. From this, what we should all realize about chewing tobacco is that it can eventually kill you. For example, Babe Ruth was into dipping and chewing tobacco. He later died at the age of 52 from a cancerous tissue in the back part of his throat. Chewing tobacco, smoking, it's all harmful for your health, and people who are struggling with it, um, moving on, the person after me will be talking about ways to prevent this and alternative ways to help them better their health.
Hi, I'm Gabriella Francis, and today I'm going to be talking about tobacco and its effects on oral health. So first off, what is oral health? Oral health refers to the health of the teeth, the gums, and the entire oral facial system that allows us to smile, speak, and chew. This is from the Centers for Disease Control and Prevention, so the CDC. So what are the possible outcomes of tobacco involving oral health? Well, of these are stained teeth, gum disease, slow healing after a tooth extraction or other surgeries, oral cancer, dulled sense of taste and smell, and difficulties in correcting cosmetic dental problems. So what this means is that when you are involved with tobacco or you are using tobacco products, you can suffer from really slow healing in the mouth. So things that usually would heal at a normal time for people will heal much slower. Oral cancer, which is a big one that people want to avoid, and it does increase the risk of oral cancer. And then you have that dual sense of taste and smell. So basically everything that you would be able to taste at a normal rate or smell at a normal rate, it's going to be a lot more dulled. It's going to be more faint. You're not going to be able to taste things as well or smell things as well. So it kind of has to do with sinuses as well. And then difficulties in correcting cosmetic dental problems. So anything that you might have gotten done or things that you're getting done, it's going to be very complicated to do with the risk of tobacco involved. So now we're looking at tooth decay. So tooth decay is a big one because it does have to do with your teeth deteriorating. So tooth decay is an important issue in oral health that tobacco users may face. So decay can result in tooth pain, cavities, and infection, thus making it a serious threat. So when we do have the involvement of tobacco, it's going to make things a lot harder. Decay is going to definitely take place because you are constantly exposed to tobacco and the chemicals inside of it. So tooth decay is when damage from decay causing bacteria affects the tooth and causes deterioration in that area. So what the tobacco will be doing is causing damage to your tooth, and the deterioration that will be taking place will definitely be very harsh, very fast. So once again, tooth decay is where the acids that the bacteria make, so whatever the bacteria that's being produced in your mouth is making, they attack the surface of the tooth instead, and they wear down the enamel. And enamel protects your teeth. It's like a coating that makes sure that your teeth are not resistant, but best too resistant to avoid anything that might happen like cavities or tooth deterioration. And so tobacco users are at high risk for cavities, of course, and even with proper hygiene, individuals will still have the possibility of deterioration. So even though you might be brushing your teeth, flossing, mouthwash, tobacco still affects your teeth. The chemicals, like I said, once again, they're constantly being exposed. So with that, you can't be promised the possibility of no deterioration. So tooth decay is usually detected at regular dental appointments and is seen as a white spot on the tooth in earlier stages. So when viewing the teeth, the dentist will usually look for spots that kind of stand out. So usually they're white spots, and this is where the cavity is starting. And depending on how big the spot is or how serious it might be, they might decide whether to fill it or watch it to see if it gets any bigger or the cavity starts to spread. So dentists usually treat individuals with tooth decay, which by that time is a cavity, by filling the affected area and removing the decayed tooth tissue. So what they do is they go into the tooth and they'll either fill it with some type of substance like porcelain, and what they do, it's kind of like a hard cement. They put it inside your tooth so they can fill it and make sure that it stops the deterioration. So in order to prevent tooth decay, people should incorporate fluoride into their brushing habits and practice proper oral hygiene. So it is very important for people to avoid the deterioration and things like that. So tobacco and oral cancer. The smoking of tobacco is linked with many threatening illnesses. So it's low birth weight, cardiopulmonary diseases, and cancer. So as well as several other health issues, it is also able to be linked to a significant impact on one's oral health, such as an increase in risk of gum diseases or periodontal issues. So looking at that, gums are also affected by tobacco, and so it's not just your teeth, it's your gums, and so you would have to make appointments with the periodontist to go check those out, because you can get canker sores, you're able to get weird markings on your teeth or markings on your gums, same thing, vice versa. So oral cancer is caused mainly by squamous cell carcinoma, which a lot of people are very familiar with because that is usually cancer and it can be cancerous. With tobacco playing a big role in the development of oral squamous cell carcinoma. So whenever you're having the exposure to tobacco and things like that, it is very possible for you to have a lot of issues, and it's very, very likely that you're going to get some type of squamous cell carcinoma whenever you're constantly doing that exposure. So the use of tobacco and smokeless tobacco does increase the risk of cancer as well. So even though you might not be smoking it and it might be chewable, whatever tobacco it might be, you are still at risk, so it does not protect you against that. So it's specifically in the upper aerodigestive tract. So in fact, the carcinogens that are in tobacco and tobacco smoke may have some correlation with the carcinogenesis of squamous cells and throughout the lung and oral cavities. So it's very important that you avoid this, because not only is your mouth going to be affected, but it's going to affect a bunch of different things, and the tobacco smoke does have some correlation with this, and it is throughout the lung and the oral cavity. So it's not just your teeth, it's not just your mouth, of course it's the lungs as well. So then outcomes for dental treatment might become unpredictable and as a result very costly to treat an individual. So when you are being exposed to these certain things, dental work is going to be necessary with all the problems that you're going to be having. If you are, there's possibility of having a lot of issues. And as a result, it is going to be costly for an individual. So whether that be surgeries, just normal dental work, cleanings, cavity fillings, it is going to be pricey, and the outcomes for the dental treatment are going to be significantly impacted. So that is it on the tobacco and the oral cancer. It is very, very, very important that whenever you are being associated with tobacco or using tobacco products, that you have to watch for your oral health, because it does have an impact on oral health. And especially with teenagers these days, a lot of people are using even nicotine products, and these have been linked to maybe certain issues in the mouth involving even cavities. So even with like the e-cigarettes, Juuls, any type of vape, it can still be possible that you can have issues in your mouth, and you are still exposing that area to potentially harmful chemicals. So it is very important that you are aware of these things and that you are very educated and know the boundaries and how to avoid oral cancers or oral problems or just overall oral health. So that will conclude my part of the presentation.
Now to discuss the short-term effects of tobacco. Regardless of how it is administered, tobacco has a vast effect on our brain. We have these receptors that release dopamine. Dopamine is basically our feel-good neurotransmitter. Therefore, our response to nicotine activates this addiction. A person can become addicted seconds after it is administered. This is because the brain adjusts itself to raise tolerance levels. Some short-term effects include addiction to nicotine, bad breath, yellow or brown stained teeth. You can have tooth decay. Tooth decay happens because there is a minimal amount of blood, oxygen supply in the bloodstream, leading to infected gums not being able to heal properly. Chronic cough. This is a result of the body attempting to remove substances through cough, but are unable to due to the extensive amount of damage to the respiratory system. Damages include irritation to the trachea and the voice box, reduced lung function, and permanent damage to the air sacs. Decreased lung capacity is another short-term effect. This occurs when the lungs are unable to expel air properly during exhalation. Some long-term effects of tobacco include acute bronchitis, which is an inflammation of the bronchial tubes. Most of us know the prognosis of tobacco can lead to life-threatening events. Not only can it lead to diseases such as cancer and emphysema, but a number of other illnesses that many of us are unaware about. Those long-term effects of tobacco also include asthma, blood vessel disease, diabetes. Diabetes occurs when tobacco use can increase blood sugar levels and lead to insulin resistance. kidney, throat, and mouth cancer can also be a long-term effect of smoking tobacco. In women, cervical cancer is a risk. It is believed that these tobacco byproduct substances damage the DNA of the cervix cells. Low fertility, miscarriage, ovarian cancer, premature delivery. There are also a few birth defects, like low birth weight, breathing problems from the newborn, and damage that may cause cerebral palsy, and sometimes sudden infant death syndrome, or SIDS. In men, a long-term effect of tobacco can be erectile dysfunction. It could be long-term or short-term, depending on how extensive your nicotine addiction is. This is erectile dysfunction is a poor blood supply to the penis. You can also have poor sperm quality, a reduced number of sperm. A sperm defect is due to the increased damage of DNA fragmentations. What do we know? Tobacco causes more injury and disease than any single risk factor. Tobacco is the leading killer of all drug-related deaths, at most 90%. Addicted smokers have 1 billion more nicotine receptors than non-smokers. So, some prevention levels include setting a good example. You are a product of your environment. So teens that have parents that smoke are more likely to have children that smoke. So therefore, you need to take your addiction seriously. As a child, from the time we enter the world, our brain are sponges. So we absorb millions of information. So placing restrictions on advertising and marketing tobacco can also prove to be meaningful resources to utilize. Increasing policy levels and regulating who can purchase tobacco products. There's a new state law coming out in September that states you have to be 21 to purchase a tobacco product. You can also do a good prevention level may be time and location of the use of tobacco. You can also decrease the amount of tobacco nicotine and tobacco usage a day. Then this may ultimately lead to cessation. There are also a number of support groups and counselings that can also be good preventions for you if you decide or you feel like you have a nicotine addiction. Reasons to stop smoking. It's pricey. Smoking a $5 pack of cigarettes a day adds up to $1,825 each year. No, I'm broke. Smoking is the #1 cause of lung cancer. 1 out of every 5 heart diseases is directly related to smoking. Smoking may also increase the risk of depression in young people. But another positive outlook is that your body begins to heal within 20 minutes of your last cigarette. But another downfall is that it causes 13 forms of cancer. Did you know a single cigarette contains over 4,800 chemicals? 250 of those are known to be harmful, and more than 50 of those are known to cause cancer. And 11 are classified as group 1 carcinogens. Ways to stop smoking. It's not going to be easy, but choosing the best way to quit is a good first step to living a healthier lifestyle. A few ways are just quitting, going cold turkey, nicotine replacement therapy like nicotine gum that you can purchase at your local stores or your CVS's or Walmart's, patches that you can also get at those places I mentioned, medication prescribed by a doctor, staying busy to distract your mind from not wanting to smoke a cigarette, or finding a replacement, something that also, not a bad replacement, but something that also makes you feel good, like running or walking or journaling. Mental preparation has also been a good way to stop smoking, and behavioral support. What to expect when you stop smoking is that it's a journey. It's not a single transition. Have a plan, set small goals, and then accomplish the big ones, and take your time and be patient. In conclusion, smoking is a habit that most individuals find difficult to quit. It may take months of preparation just to make an effort to quit smoking. What many teens and adults fail to realize is that smoking kills you from the inside out. If you or someone you know considers to stop smoking, just know that you are not alone, and there are many support groups and counseling services that are willing to help you reach your goal. You got this.